Hello, everyone. This is Cole from the American Journal of Healthcare Strategy, joined by a special guest with many decades of impressive experience, Jon Warner. Jon, can you introduce yourself and your current role?
Yeah, so Jon Warner, as you said, I've been in healthcare an awfully long time now, since the mid 90s. I started off in the UK healthcare system, spent some time in the Australian healthcare system, and 20 years now from a California base in the US healthcare system, having tons of fun trying to apply innovation and technology as best I can.
Thank you so much for coming on. And then, kind of one of the first questions I have here is you've spent time in other industries as well across your career. Why healthcare? Why did you kind of come and work for healthcare? Because it's not always the most desirable industry in terms of building wealth or having a good work life balance. It's kind of tough in both of those areas. So what caused you to move over to it?
Well, as most things, and I'm sure I won't be the first person to say careers are a happy accident. When you look back, you can find coherence in what you've done. But believe me, there are lots of happy accidents in the middle. I did a philosophy undergrad, but ended up doing a PhD. I was kind of on a journey to being a psychologist or a psychiatrist. I did finish my PhD in thinking that way. But I realized pretty quickly I was never going to be a clinician. I never had the patience for that. But I was interested on the business side of healthcare. But I ended up just going off into the corporate world. And early on, you're right. I had an early career in the oil industry, for example, climbed that little greasy pole. But I was never wholly happy, so I left to go to management consulting, and that's really got me into the healthcare world. The happy accident of getting clients in that space. Early on, it was biotech, and I did some work in pharma, and then in large hospital systems. And as you would know, Cole, it's very worthy work. I realized immediately that this mattered, and lives are at stake, and that we had a lot to fix. So it's been a happy hunting ground for far more time than the rest of my career. 30 out of the 40 years have been in healthcare, and I love it. I love every aspect of it, just because I think we can really lift people's lives up.
I couldn't agree more. I know I've looked at leaving healthcare, and I think sometimes it's good to build skills in other industries, but at the same time, it's challenging to leave because of the mission behind it. One thing that's really interesting is you have a lot of strategic advisory roles, board member roles, a lot of leadership or leadership influencing roles. Not everyone can do that. A lot of people struggle with that, but yet you have almost a surplus of these experiences at reputable organizations. Is there anything about you in particular or things that you have done that you think have allowed you to achieve that level of success in those areas?
Yeah, I think in some ways I was lucky to have the career that I did at the beginning, the first 10 years, climbing that ladder, even with an ExxonMobil, because, the training was excellent. They taught you how to do things. I got to manage lots of different things, budget and multiple functions. So, I kind of understood everything from strategy through to tactics, through to operations in a very practical way and a very eclectic way. And I think I carried that over into healthcare. So I think that's one thing that I've really got is good training and a good base to then go and transfer into. I think the other thing anchors back to being a philosopher, funnily enough. I mean, philosophy is all about teaching people contextual thinking and critical thinking. And I think I tend to bring that into it because I think that's where all journeys start is we're trying to solve problems or go from A to B. I think we first have to, really get the helicopter higher in the sky, see the terrain that we're trying to traverse, and then come up with, tactical steps we might then implement. So I've done that all the time. And I think that lends itself very nicely to both consulting work and then advisory work because I think people are looking for that big picture view more than they are sort of diving into operational detail. They've got lots of people who can do that. So I like to stay at the big picture level.
I appreciate that. And kind of a global question is you've been around the earth quite a bit, in different places. So you've seen healthcare in different places as well. It's a common kind of complaint that the U.S. healthcare is the worst. It's terrible compared to everyone else. Is what we hear on the news, what we hear on social media. I guess the first question is that true based on your experience? Well, I'll let you answer that question first.
So, as usual, it's a mixed bag. It's true in part and not true in part. I mean, I think we know this. The US healthcare system has got both the worst and the best in the world. Many people beat a path to the US. Some of our teaching hospitals are truly world class. I think we've got some amazing technology. I think we've evolved many solutions that have started here first. I think of drug development and areas like it. So I think you can be very positive and we can be very proud of that. On the other hand, we have a very complex system, the most complex in the world, no question about it. And that system is not only complex, it's costly. And I think those are the two criteria that need to change the most. We've really got to work to decomplexify the whole system. A lot of that is because of the way we play the reimbursement game. A lot of it's because of politics. A lot of it's because of a state-based system, which is very big, with 50 states in the mix. So I think we've got to go and work hard to do that. I think that means there's opportunity for us, but I think we've got to do it quickly. I think our burgeoning costs are probably the greatest concern. I read the other day that our cost by one of the estimates is what our cost by 2035 could well be $10 trillion from a 4.9 trillion estimated base today. That's doubling in a very short space of time, 11 years. That is just unsustainable in this economy. We've got to do something about it. So, in that sense, the US system is playing catch up.
I guess I have some confusion there. Because and you're kind of the right person to ask with such experience in the innovative space, but why are we innovative in one area? We do so well, better than everybody else, and then in the other area we're not innovative. We do kind of the worst. I guess from my small perspective with small teams and small organizations, it's either innovative or it's not innovative. So can you maybe just explain to me how you can have a system with parts that are mismatched like that?
Yeah. So I think the simple answer to that question is massive fragmentation. We have silos everywhere. Now, some of those are sort of created as the nation was created, right? I mean, 50 states makes it more complicated than the whole of Europe. So I think if Europe were trying to do things on a holistic basis in the same way, they'd have to let's face the same issues. We do, and it's the way we devolve power, in the country. So I think that's a fragmentation that's nothing to do with healthcare. It's just the way things are. So think of the way, say, Medicaid operates, which is entirely in 50 states and in 50 different ways, therefore. So that means innovation is fragmented. So innovation occurs, but it occurs within silos. And the problem with that is things don't connect to each other very well. So whether you're talking about the payer space or the provider space or biopharma, as a result, we don't have the connectivity we need. So it's not that innovation's lacking. I actually think we're very good at innovation. It's that we don't often tackle the complexity and the fragmentation. And that's really hard to solve because we have to go all the way back to the political will to do that, the legal structures that allow us to do it, the insurance systems that have to be in place in order to go and change, say, reimbursement models. Look how much we've had to use waivers to go and implement telehealth, for example. In fact, to this day, those expire next year. We are still 4 years later working on waivers for that. That's what stops innovation. It's not our inability to do it. It's just that there are other contextual factors that get in the way.
So a lot of C-suite leaders, of course, might be frustrated by this because they're not really politicians, and health systems are getting larger and larger. Who's responsible in the corporate world or in the health system world? Are they supposed to kind of wait for the political environment, or is there things that they can do?
Yeah, I think there are things they can do. I mean, to some extent, you're right. We need a political will, and I think, unfortunately, healthcare has become a little bit of a glass bowl that is deemed to be too fragile to touch by both sides of politics. I mean, just think about money running out in Medicare and Medicaid, for example. Now, I mean that cliff is within sight. It's within our half lifetime from here. Politicians can't touch that because there's really not a lot of benefit to them in the time frame they have available to them. So I think we'll wait a long time to get much change. I think people will tinker at the edge. So I'm a great believer in revolution from below. I think you can innovate in pockets, within the fragmentation, prove that something works, and then scale it from there. And I think that gives you the opportunity to render change. I've seen that happen again and again, and I think that's our best path forward while we wait for the small incremental changes to happen from the top down.
I like that concept. Can you just explain a little bit more about how that works? And I'm assuming that you said revolution from below, right? I'm assuming that also works on an organizational level.
Sure does. It sure does. So I think large organizations can be more intrapreneurial, which means they allow more latitude and flexibility for innovation to occur. And they want to do that because they don't want to be caught cold. We know famous stories in other industries. Kodak invented digital health, for example, but were destroyed by it because they couldn't cannibalize the income streams they were getting from their SLR cameras and film at the time. Well, healthcare faces the same problem. So, say large hospital systems, which were built, more than a century ago, made total sense back then for the population of that size. Today, they need to be devolved. So the way to do that is to create intrapreneurship to allow people to go and test local clinics and put ambulatory services in places on a devolved basis, for example. But then on the other side of that, I think you can make it happen by allowing startup companies with fresh thinking and fresh views to reimagine how things have to change in microcosm. Some of those are going to fail, but some of them are going to succeed, and they'll give us a clue into then how successful scaling can take place. And I think we're seeing that. I think the last 10 to 15 years, we've started to see that model come into play more and more.
How does that work in terms of encouraging that? Because I'm sure a lot of people in the C-suite definitely are shaking their heads. Yes, that this is a great idea. I mean, me and in my CEO here, we've talked a lot about how we want our interns to come up with ideas, and how we'd love it if our intern put us out of business, right, and came up with an awesome idea. But it's hard to actually encourage that. Is there anything that you see, common pitfalls or challenges that the C-suite experiences in the healthcare space at creating that intrapreneurship?
Oh boy, that could be a long conversation. Challenges are, entrenched attitudes and playing defense rather than offense. And I think if you're sitting there, it's very hard to render change when you're sitting, you're really succeeding to some degree in what you're already doing. I think it's all about culture. I think you've actually got to create a culture in which you create listening, you create customer or patient focus. You make sure that you've got a very safe environment in which new ideas can survive and thrive, not be shot down. You break down hierarchies. You hire individuals who've got the right not only skill set but attitude. And I think we can see that. If you and I spent long enough on this call talking about it, we could identify some best practice companies that have clearly succeeded by creating those cultures, and they win it 3x, 5x, in some cases 10x over others. So I think that's what we have to emulate within healthcare. We've got a few of those in healthcare, but we need a lot more, in my opinion. And culture would be I think Peter Drucker said it best, right? Culture eats strategy for breakfast. And I think he's right. Let's start there. And I think the rest follows.
Kind of, in a way, a personal question, but it seems like it's the right thing to do. Like you said, we have the evidence. Even in the MBA program that I'm in, we've gone over a lot of this, right? The evidence is there that diverse culture, in terms of diversity of thought, safety to express those ideas, usually ends up in higher share prices, more profit.
Yeah.
But yet we don't do that in a lot of cases, and so I'm not, I guess, understanding why leaders struggle with that. Even myself, right? Why do we struggle with giving those um, people, the employees, the option to do that? Those who are under our leadership, the option to say things that might be tough to hear or might be disruptive in a way, innovatively disruptive, if that makes sense. This episode of The Strategy of Health was sponsored by Modality Global Advisors. Modality Global Advisors optimizes hospital revenue, enhances patient experience, and delivers proven results. Visit modalityglobaladvisors.com to learn more.
Well, the simple answer again, then again, this is a longer conversation, is that change is scary. I think
Mm.
all of us as human beings like to have a routine that's relatively familiar to us. We're not things changing so quickly that they start to discombobulate us. So I think we settle into a pattern. And I think that's true on the leadership ladder. I think when you get promoted to something, you think, wow, great, I've now got more power. I've got more ability to choose what I do, and it may not be devolving some of that power to others as quickly as you might. I think in culture, you have to go and set those ground rules. So this is where startups tend to do so well. If they go and spend a lot of time talking about culture and values and how things are going to get done around here, they can go a lot faster, as we know, than large organizations. That's really what larger organizations have to inherit, make it okay to to change yourself, because that's where this all starts. We have to kind of disrupt ourselves, then we can disrupt the team, then the team can disrupt other teams, and before you know it, that gets rewarded. And I think the other side of that is incenting it. I mean, once you've got that at least being talked about, we've got to incent it when people actually behave you want them to behave, and not reward the recalcitrants or the people not changing at all, which unfortunately is what we do. We very often anchor the very behaviors we don't want because we don't change the reward systems.
Right. We encourage short term thinking still in the way that we
We do.
compensate most CEOs. Right.
That's right. I mean, even the appraisal systems and everything else, they might be misaligned incentives. And boy, we got a lot of those in healthcare where people will just game the system for the current status quo, not for where they should be getting if they thought about it a little bit more deeply.
Looking at your resume, you kind of thrive on change. It seems like. Is that just a natural characteristic, or is that something that you've actually worked to build?
I think I've worked to build it. Again, I had some luck in the mix. I mean, I've lived in 8 countries around the world now, and I think when you take yourself out of a culture of a country and the familiarity of a country and transplant yourself, I think you have to sort of adapt, adapt or die, right? So I think I've had plenty of practice at that, and I think that's allowed me to take that into every role that I take on. And in fact, I think change is something that I thrive on, I enjoy. So I think I've probably honed those skills somewhat just by forcing myself to do it. I'm like everybody else. There's times like it gets uncomfortable, but nonetheless, I think leaning into it is more fun on balance than sitting back and saying I'll avoid it. So I think that's how I think about it.
So a good recommendation for the early careerists listening is to maybe seek out opportunities that make them uncomfortable in different, geographic locations or in different industries or whatnot.
And in fact, I think that's a really good point, Cole, as well. I think people are too set in their ways. If you're sitting in, I know you had sitting in Pennsylvania. If there's a job, next door, go take it. If there's a job in California, go take it. If there's a job overseas or even a short-term posting, go take it. So I think geography is one. I also think functional breadth is interesting. I think there's lots of people in healthcare end up at the top going through a very, narrow channel vertically, going, through various sort of, mid levels before they become a manager. I think it's better to have some breadth, at least in the mix. I think it makes for a much better leader.
What do you mean? What do you mean by that? If you can explain that a little bit more.
So in some cases, I think, let's say you've grown up in a clinical pathway, in some respect, get outside clinical for a little bit, go and
Mhm.
take something on in customer service, go and take something on in marketing, go and take something on in product, go and listen to customers in the customer success area, get that experience. I think, in a startup, you would do that. You'd almost wear those hats on the same day or in the same
Absolutely.
week, right? You're probably doing that in your business. You can't be functionally narrow. Well, we forget about that in large organizations because we've got these big functions and they get hierarchical. But I think if we do a bit of it, I think you create that breadth that then serves you well later as a leader.
Yep. Nope. I agree, and I've seen that when bringing people on who are more senior is it's a challenge when they've focused on, let's just say, finance,
Yeah,
and that's all that they've done is managing budgets, and then we expect them in the startup realm to be able to do a bit more than that. It's
yeah,
really challenging for them to learn, oh, I actually have to create PowerPoints now, I actually have to
that's right.
present to external clients now. It's a challenge.
Yeah, a huge
Very good
challenge.
points. So I have to ask everyone, this question because this is what's trending in the news. But uh, I think part of the question is surrounding what we've already talked about, and it has to do with AI. Everyone's talking about AI. How do you think that it's going to disrupt kind of the stagnation that some institutions have, or the kind of refusal to accept change that some leaders have? Do you think that it's going to kind of force us to adapt, or will it not be that simple?
Well, again, boy, what a big question. So, at one level, technology comes along every, I don't know, 20 or 25 years, which is incredibly disruptive. We've seen it. I mean, just sheer computerization alone, if you just go after the Second World War, for example, made massive changes. I think the internet has arrived in the late 90s, did the same. We've obviously got much faster computers now, much faster internet connections, and now we've got AI turbocharging all of that in the last 20 or 30 years, and it's going to go a lot further and quicker. And I think it's partly because we've got super quantum computing now and this
Mm.
amazing connectivity. So I think it is going to be more and more disruptive. I think it already has been. Our world, again, we know outside healthcare, how much of us are doing walking into bank branches anymore. I mean, I can do most of my banking on a phone that didn't exist before 2007. So I think incredibly disruptive. But by the same token, there's lots of things that we get scared about that perhaps we shouldn't be quite so scared about. I think they're just tools. In some ways, I see AI a bit like, inventing electricity, which is, back in the late 1800s. It's a tool that allows us to do many things, but we have to think about the things we want to change, which for me comes down to processes. What process do we have? Let's say it's discharging a patient from a hospital. What do we want to automate in that process? And what do we want to keep as human interface? That doesn't change. And that hasn't changed for a couple of 100 years. This is just a tool we can deploy. So you and I don't think today about, oh, wow, look at that electricity that's available at my wall. I wonder how many devices I can plug in it. We don't do that. So I think that we have to get excited by technology, but by the same token, not lose sight of the fact we've got real issues to solve that we have to spend quality time on thinking about before we then deploy the technology that takes it to a better place.
And so it still then does really require innovation if we actually want to implement it. We can't just sit around and
Yes.
it won't just do it itself.
Yeah, it's application innovation, I think, and I think I hear headlines, that AI is going to really help us with anticipatory medicine or precision medicine. I heard the other day that revenue cycle management. I had a very senior leader said revenue cycle management is going to go away altogether because it will all be done by AI, and the thousands of people in that industry won't exist in 10 years' time. Well, maybe, but I think to get there, we have to think about the process. We have to think about how all of those processes in a very complex part of healthcare work. So we've got plenty of work to do in terms of how to deploy the technology. It's not the technology in and of itself, and it never has been, and I don't think it will in our certainly in our lifetimes, and probably a long time beyond it.
So I'll ask you kind of just a final question. Let's say somebody is hearing this and they're very motivated to start getting their organization to be more innovative. Let's say it's a C-suite leader. What would be just a very real, reasonable kind of first step that they should take to start them down this path?
Yeah, I love this question. So I mean, I'm a psychologist, as I said earlier. I think in the end, it's about mindset. And there's lots of stuff written on mindset. I particularly like Carol Dweck's work out of Harvard on this, which basically says we want to open up our mind to every possibility. So work on ourselves before we work on anything else. We're all prone to fixed mindset. You and I will have fixed mindsets about podcasts and interviews and how they have to operate and what's a good answer and not a good answer, and whether this is even a good podcast or not. I think we want to be open to the possibility of improvement and that things can evolve and change for the better. And I think evolving a growth mindset is part of that, which is really saying there's nothing that isn't possible. It's just not possible yet, which is Dweck's favorite phrase. And I like that because it means striving is part of the game. And innovation comes about because of the striving. It's about not giving up. It's about saying there's got to be a way over, under, around it, completely rethink it. So I think if we get that attitude right, amazing things happen. And innovation, which is a strange word because people often misdefine it, is really that process. It's the process of thinking differently about the future, or reimagining that future. So I think people can do that on day one. And I think it's first about thinking, well, where might I have a fixed mindset? So if my father told me that, I was an engineer and you should be an engineer, your first thought should be, what other opportunities are there to be other than to follow that one piece of advice? Who else can I talk to? What job should I do? What sector should I work in? What will motivate me? So I think that's where it starts for me.
Great answer and great episode here, John. Thank you so much for coming on the podcast. I couldn't be more appreciative. I hope we can have you on again in the future.
Of course, very good. Great talking to you.